I'd like you to try something right now. Swallow just once and focus on the feeling at the back of your throat. Is there something sitting there? Maybe a thickness? A film that just won't go away, regardless of how often you've tried to clear it this morning? Now, I want you to consider this. You've likely been clearing your throat dozens of times every single day. If I asked you exactly when this began, you might struggle to give a clear answer. It probably crept up on you slowly. At first, it was only in the mornings. Then it moved to being an all day problem. Now, it is just a normal part of your routine. You carry a water bottle wherever you go. You avoid certain foods. You've likely tried every home remedy friends and family suggested, and yet here you still are. But here is what I need you to understand. That mucus isn't happening by accident. It's not just your age catching up with you either. Your body doesn't do things randomly. Every ongoing symptom is actually your body's way of signaling something specific. The question is whether you know how to read that signal. Today, I'm going to show you how. In my time working with older adults in preventive health, I've found this specific symptom, persistent throat mucus, is misunderstood and mismanaged more than almost anything else. People get handed lozenges, they're told to just drink more water, and they're dismissed. Meanwhile, the real cause lurking underneath never gets addressed. Today, we're going to fix that. I'm going to guide you through 5 research-supported reasons for persistent throat mucus in adults over 55. And I'm going to do something most videos avoid. I'll reveal which 2 of these causes are likely combining inside your body right now, because they almost always do, and why that combo makes things much worse. My name is Dr. William Lee, and I work in senior wellness and preventive health. My goal for this community is simple: straightforward facts, solid research, and practical steps you can start using tonight. Before we move on, drop a comment and tell me, is your throat mucus worst right when you wake up, or is it with you all day long? Your answer to that one question tells me a lot about the driver behind this. Leave morning or all day in the comments. I read every one of them. Now let's get into the biology that most people aren't taught, which will completely change your perspective on this. Your body produces mucus constantly, all day and night. That is completely normal and healthy. Mucus serves as a protective layer for your airways. It catches bacteria, dust, and viruses before they settle deeper in your lungs, and it keeps the sensitive tissue of your throat hydrated. Without mucus, your airways would dry out, crack, and be open to any pathogen you happen to breathe in. Mucus isn't the issue. The real issue is what happens to that mucus as we get older. There is something research has proven that most doctors fail to explain. You have a system called mucociliary clearance. Your airways are covered in millions of tiny hair-like structures known as cilia. Their job, done millions of times a day without you realizing, is to sweep mucus upward and out, keeping it thin and moving so it doesn't pool. In a young adult, this system is very fast and efficient. Mucus gets produced and then cleared away almost immediately. But research shows that as we age, these cilia begin to slow down. They don't beat as often, meaning that mucus, which would have been cleared in seconds at age 40, can sit and accumulate for hours by the time you reach 65 or 70. Practically speaking, this means any factor pushing your body to make extra mucus will hit harder and stay longer in an older adult. This isn't a complaint about aging, it's simply the physiology. Grasping this is the foundation for everything we are going to cover. With that in mind, here are the 5 causes, and please listen closely because I'm going to highlight how they tend to stack up. The first cause is one you really need to note because research shows it is the most frequently missed explanation for chronic throat mucus in this age group. It is called laryngopharyngeal reflux. You might not know the term, so let me explain it simply. Most of us know heartburn, the burning in the chest after a big meal, classic acid reflux. But there is a quieter, more deceptive version with no chest burning and no digestive pain at all, just a throat that will not settle down. Here is what happens. Where your esophagus meets your stomach, there is a muscular ring called a valve. Its sole job is to stay closed after you eat, keeping stomach acid trapped where it belongs. As we age, that valve can lose some tone like an old rubber band. When that valve doesn't seal tightly, stomach acid rises. not just into the esophagus, but all the way into the throat, voice box, and sometimes the nasal passages. Now, here is the biological detail that makes it significant. The tissues in your throat aren't designed to handle acid the way your esophagus is. Even a tiny trace of acid reaching the throat triggers an immediate defensive response. Your body races to create thick mucus to coat and shield that irritated tissue. It's logical, biology, but when it happens all night while you sleep, you wake up every morning to that familiar, heavy feeling in your throat without any idea why. Since there is no heartburn or chest pain, there are no obvious clues pointing to your stomach. Clinical ENT literature shows up to half of people with this don't report heartburn at all, just persistent throat clearing, a rough voice in the morning, and mucus that builds up the moment they wake. Ask yourself honestly, is your throat significantly worse in the morning? Does it get worse when you bend over? Has your voice sounded different upon waking? These are classic signs of silent reflux. In the action plan, I will give you concrete steps that can make a difference starting tonight. Also, if you take anti-inflammatories for joint pain, like ibuprofen or naproxen, peer-reviewed research confirms this class of medication weakens the protective lining of your stomach, which makes acid reflux, even the silent kind, much more likely to happen or worsen. If you take these daily and your throat has been bothering you, please discuss that link with your doctor. Before we continue, take a moment and comment with your name and where you're tuning in from. I check the comments because I want to know who I'm supporting here. The second cause is one that usually slips in quietly. When people think of sinus issues, they picture the dramatic stuff, massive facial pressure, a throbbing head, and total blockage, the perfect sinus infection. But for many people over 55, chronic sinus inflammation happens almost invisibly. Your breathing feels mostly fine, there is no major headache, yet your sinuses are slightly swollen, making more mucus than necessary, which then drains silently down the back of the throat all day. This is post-nasal drip, and a 2024 study confirmed the average age for this is 55. That isn't a coincidence. The frustration is that many people try pharmacy antihistamines for months, thinking it's seasonal allergies, only to be disappointed. Antihistamines might dry out the mucus briefly, but they do nothing for the underlying inflammation causing the excess. Dried, sticky mucus left at the back of your throat is often worse than the original issue. The strategy with the best research backing is simple and affordable. Regular nasal rinsing using warm saline. A 2025 review in the journal Medicina concluded that nasal irrigation is a safe, effective, low-cost way to treat and prevent upper respiratory issues and is endorsed by ENT specialists worldwide. High-volume saline rinses physically clear away inflammatory mucus, lower mucosal swelling, and improve that natural ciliary function we discussed, the same system that slows down with age. The key is consistency. Using it once or twice gives you brief relief, but daily practice brings meaningful, cumulative improvement. I'll walk you through the method and the action plan. If you are still with us and finding this useful, comment number 2 so I know you're listening. And if you haven't subscribed, please do. Your support is what keeps this channel running. Now, cause number 3 catches people by surprise. When patients tell me what they've been taking for months or years, they often don't think their medication is part of the problem. There is a group of blood pressure drugs called ACE inhibitors, angiotensin converting enzyme inhibitors. They are prescribed millions of times annually, they are usually well tolerated, and they serve an important function, but they have a well-documented class. Wide side effect, they cause a substance called bradykinin to accumulate. For many people, studies suggest between 5% and 20% of users, this triggers constant throat irritation and an urge to clear it. Crucially, this is not an allergy. It is just how the drug works, and your throat is simply sensitive to that effect. The reason this connection is so often missed is that the side effect can develop weeks or months after you start the medicine. If you began a blood pressure pill 8 months ago and your throat trouble started 6 months ago, you might never connect the two. Yet, that timing alignment is exactly what the research highlights. A large-scale study of over 27,000 patients found adults over 65 had a 53% higher chance of this throat side effect than younger users. This is extremely relevant for this audience. If you take blood pressure medication and aren't sure if it's an ACE inhibitor, ask your pharmacist. They can tell you in a minute. If it is, there are alternative classes of drugs, such as ARBs, angiotensin receptor blockers, that manage pressure just as well without that side effect. That's a discussion worth having with your doctor. If you're still watching, type clarity in the comments because that's what I want to give you. The fourth cause surprises people, not because it's complex, but because it's something they dismissed as being too simple. Hydration. Let me give you the physiology because it isn't what you might think. Mucus is mostly water. Its consistency, whether it's fluid and thin or sticky and thick, relates directly to how hydrated the tissue around it is. Here's the best way to visualize it. Think of maple syrup right out of the bottle versus maple syrup that sat open overnight. Same stuff, completely different texture. Your mucus behaves exactly the same way depending on your hydration level. And here is the aging wrinkle. The thirst mechanism becomes much less reliable as we get older. A younger adult feels thirsty well before they are dehydrated. In older adults, that early warning system is dulled. You can be dehydrated enough to make your mucus thick and uncomfortable without feeling thirsty at all. If you wait for thirst, you are already operating behind the curve. A mild state of dehydration, kept up day after day, keeps your mucus persistently thick and sticky, which amplifies everything else we have covered. A practical fluid target used in clinical nutrition is about 30 ml per kilogram of body weight daily from all sources. Water, tea, soup, all of it counts. The behavioral key is deliberate, consistent drinking throughout the day, not playing catch up when you are finally thirsty. If this is helping, type 4 in the comments. And if you haven't yet, hit subscribe and ring the bell so you don't miss future updates. The fifth cause is one that rarely appears in these types of videos, and that is a significant oversight. Because for many older adults, the source of the mucus isn't in the throat, the sinuses, or the stomach. It is in the gut. Research shows that your digestive and respiratory systems are connected through the immune and nervous systems. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly affects how reactive and inflamed your upper airways become. When your gut microbiome is out of balance, a state called dysbiosis, it can trigger immune responses that cause mucus overproduction in the airways. It's not that anything is physically wrong with your throat, but rather the gut is sending inflammatory signals that the respiratory system is reacting to. This link, often called the gut-lung axis, is a growing area of study. Several peer-reviewed studies, including those in the American Journal of Respiratory and Critical Care Medicine, confirm that gut microbiome disruption triggers immune responses that promote airway inflammation. Animal studies have gone further. When mice were given gut microbiome transplants from patients with chronic lung disease, those mice displayed significantly increased airway mucus, showing a direct causal link. What messes up the gut microbiome in older adults? Diets low in fiber, excessive use of antibiotics over the years, high sugar intake, and chronic stress. These aren't exotic factors. They describe the reality for many. You won't fix a gut airway problem with a lozenge, but you can start supporting your gut microbiome with consistent daily choices, which I will cover in the action plan. Before we hit the action plan, I must say something important. Usually, persistent throat mucus in older adults is benign, exactly what we are discussing, manageable and addressable. But your body can use symptoms to flag things that need professional help, not home remedies. Please see your doctor promptly if you notice these. Mucus consistently streaked with blood, even small amounts. Difficulty swallowing that keeps getting worse. Unexplained weight loss alongside the throat symptoms. A lump or persistent swelling in your neck, or a major voice change that does not improve. Those signs are outside the scope of today's video. Please don't try to manage those on your own. Take them to your doctor. Now, for the action plan, this is where we translate these points into action. Tonight, stop eating at least 3 hours before you lie down. When you eat and immediately lay down, your stomach is still active, and that valve we talked about has the hardest time staying closed. 3 hours of upright time after eating is one of the most effective behavioral habits for reducing nighttime silent reflux. Elevate the head of your bed. Don't just pile up pillows under your head, which only bends your neck. Use a sturdy wedge placed under the mattress or headboard legs. Even a slight incline uses gravity to your advantage, meaning less acid travels up while you sleep. Before bed, drink a glass of warm water. This simple step supports overnight hydration and keeps your mucus thinner, making that morning buildup less severe. Tomorrow morning, before coffee or breakfast, drink 1 to 2 glasses of warm water. It costs nothing, immediately hydrates your body, and loosens overnight mucus before it can ruin your whole morning. It is one of the most commonly reported impactful habits people start. This week, get a nasal rinse device from your local pharmacy, like a neti pot or a squeeze bottle. Use water that has been boiled and then cooled. Do not use tap water. Add a pinch of plain salt and optionally a small pinch of bicarbonate of soda, which can thin mucus by neutralizing nasal acidity. Use it daily, preferably in the morning. Commit to 2 weeks of consistent daily use before you judge the results. Consistency is the divider between people who say it worked and those who say it did not. Also, book an appointment to review your medications relative to your throat symptoms. Come with a list, when your symptoms started and when you started or changed any medications. If you are on blood pressure meds, ask directly if it is an ACE inhibitor and if an ARB might work for you. To begin supporting your gut-airway connection, add 1 small daily serving of a fermented food. Plain yogurt with active cultures, kefir, or a small portion of sauerkraut or kimchi. These choices help diversify your gut microbiome in ways that research links to lower airway inflammation over time. This is a long-term strategy, not a quick fix, but it's the type of strategy that shifts your health baseline. Lastly, set reminders for hydration. Keep water accessible in every room you frequent and eat more water-rich whole foods like cucumbers, melons, soup, and herbal teas. Your mucus will improve within days. A quick note on common home remedies. I know you've tried some. Honey is soothing for irritated tissue. It isn't harmful and can calm things briefly, but it doesn't fix any of the 5 causes we reviewed. Dairy doesn't magically create mucus, but some people find dairy proteins create a feeling of thickness in existing mucus. If you spot a pattern, a 2 or 3 week elimination trial is worth doing. Apple cider vinegar is a popular online tip, but for those with silent reflux, adding extra acid can definitely aggravate the issue. Please be careful. Here is what I want you to take away today. That persistent mucus at the back of your throat has a reason. Actually, there are 5 potential reasons, and most people living with this never had even one of them explained. Silent reflux happening quietly while you sleep, post-nasal drip from low-level sinus inflammation, medication side effects, specifically ACE inhibitors, which often don't appear for months, chronic mild dehydration, hovering just below the point of obvious thirst, and gut microbiome disruption sending inflammatory signals your airways react to. None of these require you to accept a life of constant throat clearing. Each has a practical, evidence-based response, and none of the first steps require a prescription or specialist. They require knowledge, consistency, and a willingness to treat symptoms as signals to be answered, rather than nuisances to be ignored. If you have been told this is just aging, I hope today gave you a better perspective, because you aren't just aging. You are dealing with identifiable, addressable physiology, and you deserve to know that. Make sure you are subscribed with notifications on. I have a video coming very soon on exactly how gut health connects to the chronic inflammation patterns driving the most common complaints I hear from this age group. That is a conversation you will not want to miss. If this gave you something useful, would you share it with one person quietly dealing with this same problem? That one share costs you nothing and could truly change how someone else understands their own body. Before you go, tell me in the comments, which of these 5 causes surprised you the most, and how long have you been dealing with this? I read every comment. This is a real conversation, and your experience matters here. Take care of yourself.